Okay guys, so class is going to be canceled tomorrow. I thought I'd do my level best just to come in and give you guys the best chance since we're not going to have lab potentially before the next upcoming exam. So, so here I thought I'd give you guys the best sort of crash course I could for the whole Venus system in the Mink. And I think honestly the best way to approach it before diving into the Mink itself is just to make sure you have a really solid fundamental understanding of the vessels we need to identify and the landmarks that are associated with them. So I would encourage you guys to use this as a starting point. If you can draw what I'm about to draw right here, I think you should feel pretty confident on test day. So I've started off here with just an empty sort of outline of what a mink's body might look like. It looks like a little, almost like a little seal down there, so I apologize for my poor art skills. So I think if you can master this, I think everything else should be okay. Okay. So before we jump into the vessels, I think it'd be a really good idea just to get things started with some basic landmarks. So just follow along with the landmarks, put in the landmarks first, and I think everything else should kind of make a little bit more sense as you draw it out. So the major division right here, really as we think about this, is kind of above the diaphragm and below the diaphragm. So we'll just start off kind of putting in some of these basic structures. So we'll put in, that's actually a really terrible diaphragm, but that's okay. So we'll put in a little diaphragm, we'll put in a heart, we'll put in kind of a miniature, liver representation right there. We'll put in a stomach, kind of a little stomach. We'll put in what can represent a spleen over here. Over here below the liver, we're definitely taking some liberties here, but we'll do kind of a large intestine colon type thing. That'll be the colon, and then we'll kind of do a representation of small intestines right there. So we'll put in the adrenal glands right here. We'll do another little mock-up of some kidneys off here on the side, and then we'll put in a quick representation of some ovaries, some of the gonads. We'll just assume this is a female mink. So another little ovary, fallopian tube type thing right there. And then we'll go ahead and put the inguinal ligaments right here. We're gonna go ahead and throw in a few more divisions as well. Some of these might seem a little artificial, but they'll definitely be helpful when it comes to naming the arteries as we go along. So we'll go ahead and throw down a division right here and another sort of artificial division right there. This is gonna be to separate kind of the brachial region from the axillary region from everything else within kind of the kind of thoracic area in there. And so we'll throw in some quick little kind of rudimentary lungs here too. All right, so here we have a really basic mink with kind of representations of the organs. You have to think that arteries and veins all pass through capillary beds first. So if you can remember that all of these vessels have a destination that they're heading to and that they're coming from, it can make it a little bit easier to find the landmarks and then to kind of identify the vessels. So anyway, so let's start off with the easiest stuff. If you don't know anything else on test day, you should at least know that blood needs to go to all parts of the body, right? So you should be able to start off with kind of a little aortic arch right there. We know that the aorta descends, kind of goes down through the length of the body, and ends up having to feed the appendages. This is incredibly rudimentary right here, but it should make sense, right? And we can kind of build on it from here. So obviously if blood supply goes out, it also needs to come back. So we'll go ahead and include kind of an superior vena cava right there, and we'll include an inferior vena cava. So the inferior vena cava passes through the diaphragm, through the liver, and then down, kind of tracks the aorta most of the rest of the way down the body. And obviously drains the lower appendages as well. So from here we'll start to fill things in with some of the major landmarks and divisions that you should be able to recognize. So I think it's a little bit easier to start with everything above the diaphragm, and frankly, I think kind of the brachiocephalic trunk right here is a good place to start. So the superior vena cava is really nice because it has two major sets of veins that come in superiorly and laterally, and it kind of drains into this kind of brachiocephalic trunk right here. So we can go ahead and draw those in. Okay, and they all kind of feed together right there. So the veins extending superiorly or caudally are the external jugular veins, and the internal jugular vein actually branches off from the exterior above kind of the brachiocephalic trunk right there. Let's leave that right there for now, and we can name these things after we have everything drawn. Should make things a little bit easier. One other thing to note, from the heart itself, we've got obviously oxygen poor blood that heads out to the lungs. This is technically an artery, but it's the pulmonary arteries that leave from the pulmonary trunk. So we'll draw it blue because it's still, you know, oxygen poor, and then we'll do that on one side. And we'll draw kind of an oxygen-rich representation on the other one, kind of returning to the left atrium over there on that side. But understand this is happening bilaterally on both sides. So as we continue down, if you guys should remember the arteries, we have matched and unmatched arteries. So the easiest way that I can think of to keep them separated is honestly to start off with the unmatched arteries. And I think on test day, if you can draw sort of this basic diagram on the arterial side of things, I think the venous side should come, and I think you'll be pretty confident. So let's just start off kind of with a basic representation of the descending aorta right here. So I like to remember the unmatched arteries as like CSI, right? So arteries. So you've got the celiac artery, you've got the superior mesenteric artery, and then you've got the inferior mesenteric artery. So they're unmatched. And then in the Mink, because the adrenal glands and the kidneys themselves are separate, unlike in a human being, there's another pair of matched arteries. So if you can do that and then include the matched ones, you've got the adrenals, you've got the kidneys, and then after that, you've got the ovarian or testicular, the gonadal, spermatic arteries as well. And then you've got down there, you've got the inferior mesenteric artery, and then you've got one more pair of matched arteries. It's the iliolumbar. So the descending aorta kind of bifurcates right here, splits into a kind of a left and a right external iliac artery, and there's also kind of a continuation down there, an internal iliac artery. And then at this point, there's kind of an inguinal kind of ligament that it passes out of the kind of abdominal cavity, and once it passes out of that cavity and into the legs, the external iliac artery becomes the femoral artery. So you just think of that as feeding the legs right there. So if you can draw this on test day, I think everything else in the abdominal cavity should start to make sense as we connect up the rest of these landmarks right here. So just kind of as a quick summary, so that's the descending aorta. We've got, remember CSI, CSI, you've got the celiac artery that feeds the liver, the gastric stomach, and then the spleen. And then you've got the superior that feeds essentially the colon and some aspects of the small intestine. And then over here, we have the kind of the adrenal glands, the adrenals. We've got the kidneys or the renals themselves, and then we also have kind of the gonads. Down there we have the eye of CSI. That's the instead of the superior, that's the inferior mesenteric artery. And here we have the left and right iliolumbar. And then over here, we've got the external iliacs, and then the internal iliacs, and then down here we have the femoral. Remember, this is all just arteries right here. If you can draw this right here, if you can get that down pat, you should be able to fill in the blanks on this one, no problem. And so we'll do that real quick. Some of these, you know, for example, the celiac trunk right there, it does split into separate arteries that feed each of those three structures: the hepatic, the liver, the gastric, the stomach, and the S is the splenic or the spleen. So as we fill it in, we've got kind of our first unmatched right there. So you can draw the first branch back to the liver. The second branch, we can kind of go to the stomach, and then the third branch kind of goes to the spleen right there. And then next, as we go down, remember we have the adrenals. So down here we can have, and they're not exactly at the same plane in the Mink, but just for the purposes of identification and matching, we'll just pretend that they are for now. So we've got the adrenals, and then we have the renals or the kidneys down here. That's also another matched set. We've got the gonads. It's another matched set. We've got the inferior mesenteric right there that feeds, you know, kind of the large intestine. We're going to represent the colon being up here for purposes of the kind of the hepatic portal system, so we'll kind of ignore that. And then down here, we should have the iliolumbar, left and right. And so you can see that we basically just applied oh, sorry, forgot our superior mesenterics right here. So our superior mesenteric, that essentially kind of feeds that colon and the small intestine right there. So we've got our first two unmatched, our celiac trunk, our superior mesenterics. We've got our kind of adrenals, we've got our renals, we've got our gonadals, we've got our inferior mesenterics, we've got our iliolumbar, and then we've got our external iliac right here. So we can draw in kind of an internal iliac, and then down here as it passes that inguinal ligament, it becomes that femoral artery. So here we just translated that into this, and once you've kind of got the blood supply, it's easy enough to hook up the rest of the plumbing. So we'll start at the bottom because that just kind of makes sense. So in your Mink guide, it's not abundantly clear that there's an internal and an external iliac vein, but there is. So essentially, it kind of drains that same area right there that the internal iliac artery supplies. So basically, that's the common iliac vein. Prior to that, it's the internal iliac vein, external iliac vein, common, like we said, and then down here is just the femoral vein. As we follow it back up, we've got the left and right iliolumbar veins that kind of drain that same region. We do have a kind of a left and a right gonadal. The interesting thing about the Mink, and especially the left ovary, is that the left kind of ovarian vein actually actually drops off of the left renal vein, kind of drops down like that. So it's interesting. And there's a left and a right adrenal vein. And now we get actually up into some interesting territory as we head back north again. So a portal system is a system of veins that drains not directly to the heart. So arteries leave the heart, veins return to the heart, but a portal system takes you between capillary beds. So I mean, you can just remember the normal course of blood kind of goes artery, capillary bed, we'll call it C, capillary bed, and then normally it would go vein again and back to the heart. But in a portal system, you have artery, capillary bed, portal vein, capillary bed, and then vein. So that's kind of the kind of so artery, capillary bed, portal vein, capillary bed, vein. So back here, we have a number of, and it's mostly, I mean, it really is mostly the organs of digestion that says, hey, we just brought in some new inventory. We don't want to put it directly into circulation. We might want to detoxify it first or package it up or do some other things. So before it heads back to the heart for distribution around the body, it stops by the liver, which does most of the detoxification and modifications and other things. So yeah, so that's the kind of the portal vein system. So rather than having a representation of the spleen drain directly back into the inferior vena cava, like as with the stomach or the colon or the intestines, it actually all bypasses that. Pancreas too, but I didn't depict that. And it goes into the liver. So if you want to think about this as like kind of a river system, like I would draw it with the kind of the headwaters of the liver system. So it kind of the portal vein goes kind of enters kind of in the bottom of that lobe of the liver. So I would draw it kind of to start off from the pancreas, ultimately to the liver, or not from the pancreas, from the spleen directly to the liver. And there's a bunch of things that come in as it goes. So it starts off as the splenic, as the splenic vein, and then the kind of the gastric vein joins, and it becomes the gastrosplenic vein, and then it kind of continues on, and then the colon and the inferior mesenteric vein kind of joins in, and the last thing to join in is kind of from the jejunum, the small intestines, is the superior mesenteric vein. It kind of joins, and after the superior mesenteric vein joins, this becomes the hepatic portal vein. So this segment right here, after the last kind of the tributaries joins, it becomes the hepatic portal vein. So now we have all of our major organs being supplied with blood and being drained as well. So last but not least, let's talk about heading back up north past the diaphragm. You know what? We actually didn't address the arteries of the arteries above the diaphragm. So we'll do that real quick. So the interesting thing about the mink that differs from humans, it's kind of really structurally heavy on the right side of the body, kind of anatomical right. So my left right here. The right and left carotid arteries that track kind of the internal jugular vein, both split off of the kind of that right branch of the brachiocephalic artery right there. So go ahead and depict the first one, kind of branching off, kind of right here, kind of right before that brachiocephalic venous trunk right there. So that kind of branches off right there, kind of follows it up. So the next branch, so between the brachiocephalic trunk and the left common carotid, it becomes the right subclavian. And then over here, at almost basically where it becomes the arm, is where the other branch, the right common carotid, branches off and joins. And so after the right, so we have the brachiocephalic trunk. I'm sorry, the brachiocephalic. The right brachiocephalic artery, the right subclavian. So right here, this is the right axillary artery. So your axillary region means your armpit. So basically from where it leaves the body wall into the beginning of the arm, it's the armpit. So that's the right axillary artery. And then over here, kind of after just a little bit, there's actually a couple landmark veins, but I would just say for the purposes of understanding this, just kind of mark it as a kind of a region. It just kind of transitions and becomes the brachial artery right there. And then so likewise on the other side, this is the left subclavian artery, the left axillary artery, and the left brachial artery. So here, if you can do this right here, if you can draw this diagram and name all the things that we've talked about, you should be fine when looking at a mink in front of you, because hopefully at this point in time it's a little bit easier to identify things like the heart and the diaphragm and the liver and the stomach. You guys should be able to find the kidneys no problem. And then if you remember from last exam where the adrenals are in reference to the kidneys, like not attached but up and center, you should be able to kind of orient yourself that way. So I don't think I'm forgetting anything. So yeah, we'll jump into a quick demo of everything on the Mink, and hopefully this is useful for you. All right, guys, so this might be a complete and utter disaster, but I'm going to give it my best. I'm going to try and demo to you where all the structures are one-handed as I hold my phone and read off the list here. So I got two minks right here. Both of them are male. Unfortunately, in the little video, in the kind of the drawing, we demonstrated female. You know, it does change. You know, it does change obviously the location of things a bit. You know, whereas some of the other veins and arteries. With the female, the ovaries would be internal, and I think a little bit easier to spot. With the male, a lot of stuff is kind of buried in this pelvis area, and it's going to make it kind of difficult to find some things. But anyway, so we'll jump in and we'll just do the best we can. So obviously, the easiest landmark for you to find is going to be the heart. So from the heart extending superiorly, you can see right here, that's the superior vena cava coming out right there. Surrounded, you know, kind of on both sides. As we move up, so superior vena cava, as we move up right here, you can see kind of that's the star type section right there. That is the brachiocephalic trunk right there. So you can see like this vessel stretching out off to the side. That would be the right subclavian, and yeah, where we're at right now, that'd be the right subclavian vein. So you can't quite tell, kind of broke a little bit. This blue section you can see right here, and over here on the right, this thing extending kind of up laterally right there. That is actually the external, that's the external jugular vein. You can see a little bit better on this side right here. You can see that's kind of your central hub right there. So you've got the vena cava, superior vena cava right there. You've got this section where everything kind of comes together. You've got right here, that's the internal jugular vein, left and right. So internal jugular vein following the trachea right there. The external jugular vein really kind of is truly on the outside. You can see it kind of extending out away from there, and then kind of deeper or kind of inferior to that. That's the right. That would be the kind of the left subclavian vein. That's the left external jugular, and that's the left internal jugular following the trachea on up versus kind of on the outside. So, so we've talked superior vena cava, brachiocephalic trunk in the center. We've talked internal jugular veins, external jugular veins, subclavian veins. So as you follow that kind of that right subclavian vein right there, as it kind of exits the kind of thoracic cavity, but prior to it being in the arm, kind of in this region, it'll be the axillary vein. It's really not liberated in this particular sample, but kind of in that, kind of between the chest wall and the beginning of the arm, that'll be the axillary or the armpit area, axillary vein, and then the brachial vein as it's in there. So yeah, and then on the arterial side of the heart itself, you know, so the Mink does have, you know, these superior blood vessels, these coronary vessels that you can kind of see. It's not great, but kind of follow the kind of the sulci, the sulcuses of the heart. So basically, if you see a vessel on the outside, it's going to be it's going to be a coronary vessel. So the pulmonary trunk, so we know the pulmonary trunk kind of exits the kind of the center. The pulmonary trunk is the pulmonary artery, so it heads off to the lungs, kind of bilaterally on either side. They're all kind of smushed in there, so it is difficult to see. But you know, the artery heading out of the right atrium of the heart into the lungs. The vessel itself would be the pulmonary trunk. So the aorta leaves kind of out the kind of center top of the heart. You really have a hard time seeing it in this particular specimen right here, but it's not nearly as large as the superior vena cava, but this right here, this structure, that is right after the arch of the aorta. That's kind of what we're interested in right here. And so it branches really low to the heart, left and right. As it heads off to the anatomical right side of the body, it's going to split and bifurcate right here, kind of around the brachiocephalic trunk right there. So you can follow it kind of. So that right there is the kind of heading off to the right. On the left, there's another artery that heads out, and that's the left subclavian artery on the Mink, until once again it gets to the kind of the left arm exits the body, and it becomes the left axillary artery, and then the left brachial artery. So over here, kind of the right brachiocephalic artery right here, as it kind of approaches the brachiocephalic trunk, it splits the first time into the left common carotid. The left common carotid you can kind of see right there next to the left interior jugular vein, and then over here, as it continues out past that, you can kind of see that vein right there stretching out. That right there is the right subclavian vein, and then once it hits the kind of the chest wall, it'll bifurcate again. Actually, in this case, it looks like the bifurcation, it kind of looks like it splits off. Actually, rather than over there at the wall, it looks like it is kind of anatomically splitting a little bit sooner. It looks like it right after. So whereas the left common carotid split kind of right before the brachiocephalic trunk, the right common carotid is kind of splitting off just after the brachiocephalic trunk. But the right subclavian still continues there out to feed the rest of the body. It becomes the right axillary artery and the right axillary vein. So that's kind of that's everything superior to the diaphragm, which is this structure right here, right below the heart. So the inferior vena cava, which you can kind of see right here, kind of on that descending part right there, passes through the diaphragm into the liver. The inferior vena cava into the liver. So this one is a little challenging because it looks like the hepatic portal system, the yellow, stained pretty well, but a lot of the other structures didn't. So we can identify some stuff right off the bat. So here we have the liver. Over here on the right, we have kind of remnants of the stomach. Right. Here's our diaphragm again. There's our descending aorta, so it might be difficult to see. That's our inferior vena cava. That's our descending aorta. The descending aorta kind of comes through pretty deep back in all this mess right here. So it comes back in right here. I apologize for the poor quality of this, guys. It really kind of stays right on top of the spinal column all the way down. So I'm going to try my level best to see if I can kind of liberate some of these other structures here. There's some things that you can see right off the bat. I mean, we have a kidney right there. We have the inferior vena cava right there, and we've got the artery and the vein supplying it. It looks like a lot of the dye kind of leaked out on this one. So I'm going to move over to the other Mink. This one is a lot better, a lot more colored in the kind of the inferior region. So once again, just finding all of our structures. We've got the diaphragm right here, right on top of our nice shiny liver. We've got the descending aorta right there that comes through and really kind of exits right on top of almost the spinal column there in the back. So grab that probe again. So here we actually have this right here is the adrenal gland. So that's the adrenal lumbar or the suprarenal artery and vein right there. It's a matched pair. There's the suprarenal or adrenal lumbar, or sorry, that's the renal. Here's the kidney, right? So the adrenal, that's your adrenal gland. So that's your suprarenal vein and artery, a little matched pair. And I think on test day you won't be asked to distinguish between the two. You'll be here's the kidney, here's the renal gland, the adrenal gland, and then what feeds it right there should be a little bit easier. So here's the left kidney with its supply. Here continues the descending aorta. Unfortunately, at this point, because this is a male, the next thing down that you would see would be the veins for the, and you can actually see it a little bit here. So this right here, this kind of thin vein headed down. So that one right there is the vein for the kidney. This thin vein heading down right here, that's going to head all the way down. So here's our male, all the way down to the testes. That's the kind of spermatic vein right there. But anyway, so the inferior vena cava continues to descend. Right here's the bladder. But the truth is, I think that right there might be the right iliolumbar vein. It's another one of the matched veins, but you'd really need to spend some more time liberating this. It should be kind of bilateral on both sides. You can see there's the left iliolumbar, there's the right iliolumbar. They're definitely below the kidney level. And if you follow this down, here's his bladder, there's the penis, but literally most of the other structures, like your internal and external iliac arteries and veins, are going to kind of be buried in this pelvis area. So unfortunately, I can't do a great job of showing you that. Here we have some more of the mesentery. Let's see if I can find a good example of, I think over here, just because the yellow portal system is a little bit better, I think this might be a kind of a better candidate. So I believe this right here is the spleen, that structure right there. That would make that the splenic vein, the yellow structure. All the yellows are always going to be, they really try to stick to the convention of yellow equals portal. So that should be the kind of the, off of the spleen, the splenic vein, that should join up with this empty structure right here is the stomach. So that becomes the gastrosplenic vein. It kind of joins together. It's kind of broken up in there, but gastrosplenic. And then the inferior mesenteric vein drains the colon and some of these lower structures. So coming from down below, there's that. The right going into the liver, right here, that's going to be your hepatic portal vein. And then immediately below that, the last thing to drain into it is going to be from your superior mesenteric vein. So that might be tough on test day, but I don't think we should be. I don't think we'll make it too hard. As long as you can find the liver, as long as you can find that big empty sac, the stomach, the spleen, and then the mesentery is tough, but I think on test day we won't make it too difficult. We'll have nice separated veins, and as long as you also know just kind of what the other structures are, like you should be able to tell that that's a kidney, right? And so the adrenal, the adrenals will be just located just up and to the left. So if you can just find your landmarks, I think you should be good. Sorry, this wasn't the greatest. Kind of doing the best I can here at 9 o'clock on a Tuesday night, but hopefully you guys won't feel too far behind.